Welcome, everybody, to another edition of Insights into Addiction and Mental Health. I'm your host, Scott Jones from the Addiction Training Center. I want to thank everybody for joining us today as we do our, I guess what you would call our holiday episode. We're going to be talking about the holidays, whether it be Thanksgiving, Christmas, New Year's. A lot of holidays coming up, and that could be a really dangerous time for addiction and mental health. So we're going to be talking about that today. Just want to remind you that Insight is into Addiction and Mental Health is brought to you by Neuropsychiatric Addiction Clinic. You can reach them at on the internet at npaddictionclinic.com. I always get that wrong. npaddictionclinic.com, or you can give them a call at 844-282-1306. That's 844-282-1306 for the Neuropsychiatric Addiction Clinic. Please check it out. If you or someone that you love is struggling with addiction or has a problem, or even if you just have a question, give them a call. Now, speaking of neuropsychiatric, our guest today is Erika Melecio. She is the lead therapist at NP Addiction Clinic and, fully licensed and everything else. But you are like second in command to the clinical director, I believe, right?
That's what he tells me.
That's that's it. Now you've been with before we get into the topics and stuff, just so we can lay some groundwork. You and I've talked before. We've done some shows before, but you've been with NP Addiction Clinic, which is a fairly new place. But you've been there from almost the beginning, haven't you?
No, I've actually started about a year and a few months ago. So maybe a couple months after they originally started.
Oh, okay. So you were close to the beginning, though. I mean, they opened up in a pandemic, which was a difficult time to begin with, and then you joined them. And how were things going into your? I guess it would be we're heading into year number 3 of the clinic. How are things starting to look, and how are things shaping up for you guys there?
Things are going pretty well. We've had a lot of different clients that come in. We've been very successful with them. Having the different type of communities that come in, sometimes we get more mental health than substance use. Sometimes it's the other way around. So, it's been really rewarding to see, mental health and substance abuse clients, getting together, collaborating and things like that. It's been a great time here working with the clients.
Now, when you talk about mental health and substance abuse, and it goes hand in hand in most cases, of
hmm
course, but there also has to be some different modalities if you're going to be treating both of these populations, and of course, different skills. So you are ACA licensed, so you can specialize in the mental health
hmm
if that's where they need to go, right?
Yes.
Okay. There's a lot of places out there that aren't doing that. I bring it up a lot, but I want to make sure people understand if they're not licensed for mental health, there's a lot of mental health issues they should not be handling. Isn't that true?
Pretty much. I mean, you want to make sure that you have people that are trained in mental health, who've had experience in mental health to be able to treat clients that have primarily mental health issues.
So, what kind of mental health issues are we seeing a lot of these days? I'm sure there's probably the rare cases of something, but what are some pretty standard things that you're seeing out there that people need help with?
We are seeing a lot of schizophrenia, bipolar, borderline personality disorders. We've seen some narcissism. Um, that's mainly the main ones that we get is bipolar, borderline, depression, anxiety, trauma, a lot of trauma.
Now it's interesting. You say things like depression and anxiety, and there's probably somebody out there listening saying everybody gets depressed, everybody gets anxious. At what point does it become an illness and not just a part of life? You know what I'm saying? Because everybody does have moments of depression and moments of anxiety,
Yeah,
but
yeah.
at what point does it become a problem, and how does somebody recognize that?
One of the things that people should probably focus on is if the depression starts affecting other areas of your life. If all of a sudden you're having a hard time getting up in the morning, taking a shower, taking care of your ADLs, going to work, if you're isolating, if you're withdrawing from people, um, sometimes people get stuck in their heads a little too much and it's just hard to kind of get out of that. Having a hard time concentrating, and if the typical things that you do to just kind of like try to get out of the depression, like if eating healthy and exercising are things you typically do and it kind of helps you get out of depression, all of a sudden that's not working, then you might want to start looking towards talking to somebody or getting medication management and things like that.
Now, if somebody wants to kind of just talk about it, maybe find out more, maybe a concerned parent or something, they can call you guys and you guys can kind of do a, I mean, not necessarily, it's not like a full assessment without the client, but you can give them some ideas and talk to them about whether you think it's important for them to come in, right?
Absolutely. Typically, we do a screening to kind of get a little bit of background information. And if they're deemed suitable to come here, then they come in. We do a full biopsychosocial assessment. They see the psychiatrist, they see the medical doctor. So they basically get, all kinds of services to ensure that they're getting what they need.
Now, you guys being this experience with the mental health issues, that kind of gives you a leg up with the addiction as well, because
Mhm.
there's almost always co-occurring disorders of some kind, whether it's trauma or anxiety or something else. So
Mhm.
that does help you when you're doing treatment for addiction as well, doesn't it?
Yes.
Excellent, excellent. Now, one of the things I want to talk about is and I want, again, I want them to call neuropsychiatric, talk to you guys about whether it's addiction or mental health. I also want to add in, because I always forget to mention this, you guys accept pregnant women too. That's
Yes.
important.
Mhm.
There's a lot of places out there that won't do that. What makes you guys equipped to do that, or what do you do that allows you to bring pregnant women in?
I mean, we do, if there's services that we can't provide, obviously, for pregnant women, we do make appointments for them to see the OBGYN and things like that. But typically, when we get the pregnant women, they're not so far advanced that they're about to give birth. You know what I mean?
Right, right,
It's
right.
still typically in the early stages and stuff like that. So things that they can, address in an outpatient type of way, as in, we take them to their doctor's appointments and things like that.
I think sometimes they might be afraid because they haven't had prenatal care at all. They've been
Mhm.
doing drugs. They're concerned that it's just too late to do anything about it. But it's never too late to try, right?
No, absolutely not. And that's something that we try to encourage to all our female clients who are pregnant and come in. If they're a little bit apprehensive about getting the care, we just kind of, um, get them to talk to medical about it. And, they'll let them, they'll explore the importance of, seeking medical attention and things like that. The therapist will also talk to them and kind of try to ease their nerves about, doing things like that. So.
Excellent. Now, Erica, do you have like a special area that you work in, or do you cover like all the bases, or do you have like a specialty that because I notice you do have a lot of people in there. Some people are really good in this area, some people are good in that area. Do you have gaps that you like to fill yourself that you really like working with?
Um, I think that we all work towards getting all kinds of different trainings and learning more about whatever needs to be learned about. Um, I think I like to work with people who have schizophrenia a lot. Um, I like to use a lot of cognitive behavioral therapy and things like that, and just really focus on understanding the client and seeing what it is they want, what they want to accomplish, what they need to work on. A lot of times people get so focused in, oh, I did the assessment, I diagnosed you, this is what you need. And they forget to ask the client, well, what is it that you need? What is it that you want? What are you hoping to get out of this? And so I think that's the way that we kind of um, get this therapeutic relationship started, that make them understand that this is, a therapeutic journey for both of us and that we're going to
Yeah.
be doing this together.
And if you're allowing them to if they're assigning certain goals themselves, it creates a better motivation, doesn't it?
Yes, absolutely.
So I understand the process with addiction treatment, and getting families involved and educating families and stuff. I would assume, but I'm not sure. Maybe you could tell me. Is it the same with mental health? Is family involvement and family education just as important?
Yes, yes. There's a lot of one of the things that I've experienced with specifically with people who have schizophrenia is the parents don't really understand what it is. Some people shy away from doing the research or asking questions. So typically, when I speak to a client, they'll be very upfront and tell me, hey, my parents don't really understand this, or I feel like I'm not understood by so and so. So we'll have family therapy sessions. I educate the parents. I give them like paperwork or like psychoeducational work from different websites and things like that, just to kind of help them understand. So it's definitely important for substance use and mental health. Yeah.
Absolutely. Yeah, you made a good point too. A lot of people don't understand
Mhm.
what the illnesses really entail. I think the education for most people about mental health addiction is maybe something they saw in movies or TV shows.
Yeah.
So it's a little twisted. So
Hmm.
there's a lot people need to know, isn't there?
Yes, yes. It's not exactly realistic.
Yeah, yeah. That's true. That's true. Now we're going into the holidays. We got Thanksgiving is here. Christmas is right around the corner. New Year's. This is a dangerous time for addiction and for even mental health because of all the stressors and family and everything else. Is that a true statement? Do you think?
You know, I had my first Christmas here last year, and I honestly was expecting people to like be having breakdowns and things like that. And I think that we really focused on collaborating with the clients, on really celebrating the holiday. And we ended up doing a lot of, recovery related activities that geared towards recovery, mental health, and things like that. And at the end of the day, when all was said and done and we kind of processed everything, the clients were like, yeah, I didn't it was actually a really good day. So I get really excited around the holidays because it's fun to show the clients like, hey, you can have fun in recovery. Like, every time somebody's like starts laughing when we're doing an activity, I'm like, see, you're having fun and you're sober, it's possible. So it's really fun.
I've always been able to share with clients, when I've worked with clients during holidays, if you can commit to missing this one, you don't ever have to miss another one.
Hmm.
But when people are out there and they're still active, the holidays can be a very dangerous
Yeah.
time. I know a lot of people don't like to come in during the holidays
Hmm.
into treatment. If they're already there, that's one thing, but
Yeah.
they don't like to come in. But there's a lot of suicides. There's a lot of stressors. There's a lot of things that are happening out there. It's a very dangerous time for them on the outside, isn't it?
Yeah. Oh yeah. Yeah, especially when you don't have that support system and things like that. It can be, yeah, it can be very overwhelming for somebody. Yeah, absolutely.
I mean, a lot of times when you're dealing with addictions and mental health, and there's a lot of shame and guilt and other things that are built around that into the person who's suffering. And then when you're face to face with family, that compounds and it becomes
Mhm.
very dangerous. So if I guess my point is, just because Christmas is right around the corner, don't wait till after Christmas. If you're struggling, do something now because you don't know when that point is where it's going to be too late for you, right?
Exactly. Yeah. And I think, one of the other things that I really like about the holidays here too is that we're very observant when we have certain clients that like to isolate. And so especially on the holidays when people are going to be like, "Okay, well, I'm just going to stay in my room and not, hang out with people." I'll be like, "Knock knock, hey, what's up?" Like join us. Come on, let's do stuff. So it's very important for the mental health population as well.
And it's kind of funny. I mean, this is certainly not a hard written rule, but for the majority of people that have been home for holidays before,
Mhm.
if they're interactive addiction, they're not really experiencing what it really is all about.
Exactly.
So they think they're actually missing something. And it's almost like, well, you've been missing it for years.
Hmm.
Let us teach you how not to miss it anymore, right?
Yeah, yeah.
How
It's
to be
it's
present and enjoy things.
yes.
Um, yeah, that's really important. Um, Now, somebody who's new in recovery, because
Mhm,
you certainly you're very supportive when people leave the facility and you set up
mhm.
aftercare and
Yes.
I know you guys follow up and make sure everybody's doing well.
Mhm,
Can you give us any suggestions? Maybe some people out there are listening, they're new in recovery. They've got a week or a couple of weeks or even a couple of months or maybe even a year, but
mhm.
holidays can be stressful. What are some good clues or tips to use when you're starting to feel off a little bit and you're new in recovery?
Um, Having a support system and like establishing a support system, maintaining that support system is really important. If one of the things that clients often say that they've learned is, if you surround yourself with positive people, you're going to be positive as well. So having a good positive support system is extremely important. You know, a lot of clients, start with going to meetings, getting a sponsor, and through that network, they start, meeting supportive individuals. So if anything, that's what I would suggest. If you're feeling a certain type of way during the holidays, you don't feel like you have anybody to turn to, go to a meeting, talk to your sponsor and things like that. And get that started.
I am aware that in most areas of any size population where they have maybe AA or NA clubhouses, things like that,
Mhm.
they usually have marathon meetings going during holidays or at least special times. They add extra meetings. So yeah, well, I encourage people, if you're feeling a little bit off, go and talk to somebody, go and build some fellowship or do something, talk to your sponsor. But
Or
also,
even attending an online meeting too. People forget
yeah,
that those exist.
I was just going to say that. This is like a whole new world that we're into now. I know we've had
Mhm.
online meetings before, but now they've become
Yeah.
very important to us.
Oh, yes.
And sometimes it's just that it doesn't have to be a miraculous moment. Sometimes it's just touching base that can change the whole course of your day, right?
Yes, yes, absolutely. It's just it even if it's just attending the meeting and, logging in or whatever, at least that's still recovery based. You're doing something recovery related. So now just by pressing that button and signing on, now you have recovery on the back of your mind, you know? And it's just making that process, bigger and better and continuing on with the recovery and things like that. Yeah.
Now, even at our best, with neuropsychiatric and anybody else who's working with families, we usually get a small number of people that we have access to and that can work with, maybe the mom and the dad or the wife or the husband,
Hmm.
or possibly the adult kids. So we might work with a few, but they're going to be surrounded by a great deal of people during holidays, some of them having no understanding. um, and I think sometimes people in recovery get defensive. It's like, you don't understand. I got to make you understand what I'm going through. I mean, do you know what I'm talking about? I mean, that's a difficult thing to deal with when you think people don't understand you.
Um, yeah, when it comes to like family members, not
Yeah,
understanding. Yeah, one of the things that we kind of address that is usually like, let's say that a client is brought to NPAC to start the intake process, stuff like that, and they're brought by family members. Usually, the one of the therapists or the clinical director will go out there, introduce themselves, and start having a conversation with the parents or the family member, and kind of start building that rapport, so that we're all kind of in this together. And sometimes we take that opportunity to show, to teach them like, hey, this is typical of recovery. This is typical of somebody who's struggling with mental health. All these things that you're seeing right now are normal. So that's another way that we kind of try to bridge the gap.
right. So if you are in situations where you have a large number of people there, and again, not all those people have had access to getting the help or the education that you guys can give, but stick with the people who have, and stick with the people who do understand you, and
Mhm.
sit at their end of the table on Turkey Day, right?
Yeah, I mean, if there's those that really don't want to try to understand, they don't want to get the information, then one of the things I suggest is, kind of distance yourself a little bit until they'll because you can't make somebody want to learn
Right.
about substance use or mental health. So at the end of the day, it's like, you can only control yourself. If somebody else doesn't want to learn or doesn't have that interest to learn more about you, then at the end of the day, it's in your best interest just kind of, you know what? I'm gonna excuse myself from you for a bit until you're ready to, you know,
Right.
come
If
around
they
and
ever are, exactly. But
mhm.
I think that I know that when people walk out of neuropsychiatric, they're aware, this is my fight, this is my life, these are my
Mhm.
issues, and I'm going to go do them. And so they are focused on themselves and their recovery.
Mhm.
Um, I assume mental health is the same.
Yes.
What about family members? And we'll talk about this. Like, again, you're surrounded holidays. You start to possibly get a little bit scared for people who are new in recovery.
Mhm.
What are the resources that family members can use if they're concerned about somebody and it's starting to really occupy too much of their time?
What do you mean?
Well,
Like,
I mean, if somebody, there's a lot of times when people go home after
mhm.
treatment
Mhm.
and family members get hyper vigilant about watching them and paying attention to them, and it could get very stressful for them too. Now, it's good to care and it's good to be, you keep a watchful eye, but it goes a little too far. What are some
Yeah.
resources for families to do
Yeah.
when somebody's in recovery?
The one thing that I always encourage every single client to do when they leave here is continue family therapy, because at least you're going to have that therapist who's going to be there to support you and kind of, help you set boundaries if need be, continue educating, family members and stuff like that. But that's the number one thing for me. Continue family therapy, continue seeing a therapist, because at the end of the day, like, let's say that they can't do family therapy all the time, but you're still seeing a therapist, you know, that therapist can still communicate with that family member or whatever, to make sure that everything's, getting resolved.
Yeah, I think that's so important, and I wish more people would get involved that way and do that,
Mhm.
even if the client, the person themselves with the mental health or the addiction issues, were going to therapy, and then once a month the family would come in and join them or something,
Mhm.
because it's the stuff that you don't even know what questions to ask. Having that professional there can help bridge that gap, right?
Yes, yes, absolutely.
Because all they're
Mhm.
working on is these gut emotions and these feelings and
Yep.
these suspicions and all these other things are going through their heads,
Mhm.
and they don't even know how to put them into words, and it can become caustic if they don't do something, right?
Exactly. I also, on top of family therapy, I also suggest that the family members get therapy themselves,
Right.
so that they can continue addressing, some of their personal issues. And, because you can't just solve everything during a family therapy session. Sometimes you need to see an individual therapist too, because sometimes people get a little excited and be like, hey, these are all the things we need to address. And it's like, all right, in due time,
Yeah.
so it's also good to, if they're not willing to at least do family therapy, that the family gets their own counseling as well.
Well, this is a long-term problem, and long-term solution. It's not
Mhm.
something. I'm glad you brought that up, because I think a lot of people have this false idea that, as good as neuropsychiatric is, you're the beginning of solving the problems that they have. You don't solve all
Exactly.
their problems and have them walk out a whole person.
Exactly.
It's
And
almost
it's
like what we're doing is we're exposing this is what we need to work on, but it's their work
Mhm.
to do for the rest of their lives.
Exactly. And it's not to say that they're going to be in therapy for the rest of their lives,
No, no, of course
but
not.
they're going to get to a point where, the therapy decreases as things continue to progress, and that's completely fine. But yeah, I agree with you. Sometimes people think, oh, well, you went here, now you're fine. It's like, no, this is just the beginning. This.
Right, right, and I agree. I don't want anybody to think that we're saying that the rest of your life is work and toil and difficulties,
Mhm.
because with each new thing that you experience, you gain a new perspective on life, and you
Yeah.
become happier and you become freer.
Yeah.
But it takes time. You don't spend 10 years screwing your life up and turn it around in 30 days. It just does. The
Yeah,
physics don't work.
that's too much pressure to put on somebody. That's
Yeah,
impossible. Yeah.
yeah. Do you find sometimes families do have that expectation though?
Yes. Yes. And oftentimes I have to be like, this is just the beginning, especially when somebody who's, let's say, an opioid user and they have severe trauma. It's like the trauma is not going to be resolved just like that. It's going to take work, it's going to take work. And it's just, that's another part of educating the parents, when they come in and when we do family therapy sessions, reminding them that, this is going to be an ongoing process for a while, but it's going to get better.
I love that, that you guys care enough to share that with families and stuff.
Hmm.
And you know, of course, there are times when maybe the family isn't a healthy environment. I mean, let's be honest. If they're coming from a family that is maybe involved in similar activity and other things,
Hmm.
um, you know, then maybe perhaps it's better for them to go somewhere else for a period of time. And that's where we have sober livings and we have halfway houses and things. Uh,
Exactly. Yeah.
are you guys involved when it comes to looking for the right place and vetting to make sure that they're a good place?
Yes. Yes. We definitely do our research, and we have a lot of connections with different places. Um, I know that in the past, if we hear the same type of complaint from different clients throughout time, we know, okay, you know what? This is not the place that we're going to send clients. And
Right.
sometimes, like, it's a combination of them telling us something and us finding something out as well from that place. Whether it's through somebody that works there or something like that, or any type of contact that we have with them. It's like, you know what? We know that this treatment facility is not going to be their best option. So we just take it off the list.
Good. That's excellent. And so I think people, I mean, that could be another question that you might want to ask families, or if you're calling to talk about that, is talk about, what are the options for afterwards too, because that's just as important, certainly.
Mm-hmm.
Um,
Yes.
What you guys don't want, you'd like to follow them and never see them again, but follow them and know they're having a great life. You're not those people that want to see them come in 6 times in a row, right?
Yeah, I mean, if they do come back though, we literally welcome you back with open arms.
Well, certainly, certainly, but
Yeah.
that's not part of your business plan, let's say.
No, definitely not. Once clients are here, I'm like, all right. I was like, best of luck. Thank you so much for working with me. And I will not see you again. I mean, it's kind of a little joke that we have, but and if they happen to come back, it is what it is. Addiction's not the easiest thing to get through by any means. Not at all. So it's understandable that relapse is a possibility and things like that. And at the end of the day, it's just we're here.
Relapse is a possibility. It is not a part of recovery. It might end up being a part of your story, but it is not a part of recovery. Recovery is
Mhm.
about not doing that stuff. And you guys do such a great job there. It's such a great atmosphere. I love all of you guys. Whenever I come in, it's just feels. It's almost like it's almost like this little country store. When you walk in, everybody knows and everybody smiles and everybody waves.
Yeah.
Uh, how do you, in a beautiful facility? I mean, when you walk into the facility, you think this is modern. This is like a brand new hospital kind of facility. It looks beautiful,
Yeah. Yeah.
and you expect everybody to be kind of stiff and uptight, but that's not the people at all, is it?
No, not at all. We're all just a very tight knit group of people. Everybody's very respectful. Everybody gets along. Um, Everybody does their job, but we also like to have fun with people here. Especially clients. You'll see us. Cracking jokes with clients and just making everybody feel at home. You know, while they're here. Not to say
Yeah,
this will be your home indefinitely,
yeah, yeah,
but
yeah. Yeah, I mean, get comfortable, be happy, but don't get permanent because
because
we
change
want
is good. Change is
yeah,
good.
you want them motivated to get their butts out the door and start living
Hmm.
their lives, but
Yes,
you
yes,
also need them
absolutely.
patient enough to wait until it's ready. So that's
Hmm.
kind of a tough balancing act, isn't it? You don't want them to become so dependent, and we've seen this happen where people become so dependent upon a treatment facility that when they leave, they just want to come back in.
Yeah, and when we catch that, it's all about the therapy process too. We always encourage clients to look forward to change. Change doesn't have to be terrible. Yes, it can be uncomfortable, but it's uncomfortable because you're not staying stagnant, because you're moving forward. You're doing something positive in your life. So change is good. And clients do get comfortable. Sometimes they really don't want to leave. Sometimes we have to push them out, but it's just about you're ready. It's okay. And if you need anything, we're still going to be here. We're still going to be here. We have clients to this day that call us after they leave, just to let us know, hey, we're doing good, we've got a job, we're doing this and that, we're still staying sober. So it's like we do everything that we need to do while they're here, but at the end of the day, if you're ready to go, you're ready to go, and it's okay.
Erica, you know as well as I do, we get too many of those calls that somebody didn't make it, and it's heartbreaking and it's tough. But thank God for those other calls of these people, like you were just saying, who were saying, "Hey, I just got married, and I got
Yeah.
a raise at my job. I'm buying my first house." It's like,
Mhm.
wow, miracles are happening all the time,
Yeah.
and it's really cool. Does that feed you personally to be a part of all of that?
It's definitely a good reminder that what we're doing is good.
Yeah,
It's definitely fuel for some people to, you know, continue doing what we do, because that's what we do it for. We're trying to help people,
yeah,
So it's definitely nice to, when we hear from clients that they're doing good, it's definitely rewarding, because we know that they're the ones that did the work. I mean, we give you the tools, but they're the ones that do the work. They're the ones that have to challenge themselves. They're the ones that have to, stay sober and, work on their recovery. So it's amazing to see the people that walk out of here and are successful.
yeah, incredible. And it makes it easier to get up the next day and keep going. It really does. Really does. But there's so many great stories. Neuropsychiatric Addiction Clinic. I want people to check it out. npaddictionclinic.com, or you can call 844-282-1306. And don't just talk to the person who answers the phone. If you got a specific question, you want to talk to a member of the clinical staff or a member of the medical staff or even one of the owners, you could do that
Hmm.
and they will talk to you. I know one of the owners,
Oh yeah.
Joe's on the phone daily with different
All the time.
clients and different. Yeah,
Yeah.
yeah. I mean, and he doesn't have to be doing that.
Mhm.
Bob is always involved, and of course Aurelio and all the other people there.
Yeah.
And give my man Richard a hug for me, because
I will.
he always brings that joy and that happiness everywhere he
Yeah.
goes. They're just so many great people. And the
Oh,
dog, what's
yeah.
the dog's name? I forgot the dog's name.
Captain.
Captain. That's right.
Yep.
Captain. Just brings
Yeah,
a smile to your.
he's passed out right now.
Oh, he's best.
Yeah.
He's
He's
busy
taking a
making
nap.
people happy. He's got a busy job.
Yeah, he does. He does.
Eric, I want to thank you so much for your time. I know you're really busy, and you do a great job there. Thanks for everything that you do.
Thank you. I love doing these. It's always fun to, get to see you and answer some of these questions. And hopefully, this helps other people kind of ease a little bit of their anxiety and kind of get in here and, see what this is all about.
And one last time, let's remind everybody that just because it's a holiday season doesn't mean put off getting help. If it's mental
Mhm.
health, if it's addiction, if you don't know what it is, but something is desperately wrong, reach out for help.
Yep.
Don't wait. We've seen people say that I'll deal with it next month, and then bad things happen. So
Yep.
if they're feeling something, they got to deal with it, right?
Exactly. Yes. Even though you don't want to, it's good for you.
Give yourself the best Christmas gift you can give yourself, and get somewhere where you can be safe and get treatment and get help
Mhm.
and start your life over. Do whatever you want to do. It's like a do-over, It's
Yeah. Yeah.
it's an amazing thing to see somebody come in who has spent all their time screwing things up in their life, and then to walk out and say, I got a fresh new start, and they grab onto it, and it's
Mhm.
incredible. So
Yep.
that's the best gift we can give each other, is hope and help. So I want to
Absolutely.
thank everybody for joining us right here, Insights into Addiction and Mental Health. My guest, Erika Melecio, always a pleasure to see you. I hope you and your family have an absolutely fantastic holiday.
Thank you. You too.
All right. With that, I want to thank everybody for joining us. You've been watching the ATC Network. If you like this show, please subscribe to our channel and share it with your friends. Until next time, we'll see you later.